Welcome to Vance Physical Therapy and follow us live via Facebook. We're glad that you joined us tonight. Hopefully, if you haven't been able to get on, you will. We will also have a recording and we'll post it on our website, vancept.com, after probably tomorrow or something. All right, so if you have any comments or questions as we're going through this seminar tonight, please leave us a note. We have people here that are going to be fielding questions. So go ahead and type in the comments and let us know. If for some reason as we're going through the content of the webinar and there's some questions that you have that you don't understand, make sure that you go ahead and ask those questions so that we can handle that. Because I know it might be it's difficult to stay with us if you're brain somewhere else trying to understand something that you missed. Okay, so don't be bashful, please. All right, so tonight we're going to be talking about the knee. We're going to look at common causes of knee pain. We're going to also be looking at common things that you can do to prevent knee pain if you don't have it, but also for those that do have it, some things that we can do to help with knee pain. So there's a lot of things that we're going to look at. We're also going to do a demonstration on a really unique and cool instrument that we're going to utilize and that we use here at the practice that really gives us a lot more information as to what's going on. In this instance, we're going to be using it talking about the knee, but we use it actually at the shoulders, the elbows, wrists, knees, hips, all the peripheral joints. Provides a lot of information and really helps guide direction in treatment diagnostically. All right, so we're going to talk about knee pain. Here we go. One of the common conditions that we run into are strains, knee strains. What are knee strains? Knee strains are microscopic tearing of the muscle. All right, there's different degrees of a strain, and what happens at the cellular level is you have the muscle tissue and the tendon, and basically you create a little small tear in it. It may be microscopically if it's a very small degree, or it may be a complete tear, for instance, where the tendon comes off the bone. Okay, that would be a much more significant, or a tear through the tendon muscle. That would be a much more significant strain, but it's all kind of in the same category of strains, just different severities of strains. Very common in the knee, and strains happen to the muscles. We're going to differentiate between strains and sprains. So the muscles can have a strain. There we go. All right, so the next thing we have are sprains. Again, there's different degrees of sprains also. A sprain is similar in that at the cellular level of the tissue, you have a little bit of a tear. One of the differences is that a sprain happens to a ligament as opposed to a muscle or a tendon. The ligaments are also different because basically both ends of the ligament connect to the bone, whereas the tendon connects from bone to the end of the muscle. So it's kind of a continuation of the muscle tissue into the bone through the tendon. But you can see, oops, we went too far here, back up. There we go. All right, so you can see here, this is the lateral collateral ligament. This is the outside of the knee structure. Here's the inside of the knee structure. But it's just showing different kinds of sprains, the ACL, this is obviously a greater sprain compared to the other sprains that are more grades 1, 2 versus a much more significant sprain on the far side on that medial collateral ligament picture. Similar to the strain, but different structure. Okay, another common condition that we find is arthritis. Now I want to differentiate two different kinds of arthritis. There is osteoarthritis, there is rheumatoid arthritis. Osteoarthritis is wear and tear of the joint surfaces. All the joints in our body, these kinds of joints, for instance, have articular cartilage, okay, on the surfaces of the bone, on the ends. And the articular cartilage has this nice shiny surface, and that is what surfaces are, excuse me, there we go. That's what surfaces are contacting and weight bearing. All right, so what osteoarthritis is it's wear and tear of those joint cartilage surfaces. Differentiating that from rheumatoid arthritis is an autoimmune disease where your body sees itself as an invader, particularly the joints, and it causes an inflammatory process of the joints that then causes destruction of the joints in the long term because it causes an immune response. So your body basically attacks it thinking that it's a bug or something bad, and that causes an inflammatory process which over time causes destruction of the joint. So you can see here we have a nice surface on the end of the femur, whereas here you have some wearing and degenerative cartilage. So obviously this is a nice new knee, normal knee, and this is an arthritic knee. Sometimes I liken it with patients to, especially when they get clicking and grinding in there, a car with the tires stuck in a pothole, and then it gets to the end of the pothole and it finally gets over the bump and you get a little click. Sometimes that happens in our joints with osteoarthritis. So that's arthritis. Patellafemoral pain syndrome. This is a pretty common issue, and it is a little bit of a general, non-specific name for pain around the patella or the kneecap and the femur. There are several things that can cause this kind of a problem. One of the common causes is poor tracking of the kneecap, because as the knee bends, that kneecap has to slide in this groove. And if there's a problem that causes a change in the structure of how that kneecap is sliding, then you can develop pain. You can develop wear and tear because the underside of that kneecap also has cartilage. Also, you can have changes in structure of the body where you have a greater angle here, which is more common in females than males. They have what's called a Q angle, and it's greater, so that can alter the mechanics of the knee, as well as limited mobility of the kneecap, where it's not moving the way it should, and weakness, because there's muscles and that moves the joint, and so if the muscles have a weakness and it's not moving in such a way that is optimal, and they aren't pulling equally, because the quads have 4 muscles here, and there's an imbalance, then that can change what happens is that at the kneecap also, and can develop patellafemoral pain syndrome, as well as weakness in the hip muscles, because those muscles help line the femur up. So if there's weakness in those glutes, that also is going to affect what happens below it at the knee joint. Similarly, issues of the angle can change what happens at the knee joint, and will also potentially can be a contributing factor for patellofemoral syndrome. There we go. All right. Oops. Cheating. One too many. It's going back, but it's moving slowly for whatever reason. Next, we're going to talk about a meniscus tear. All right, so here's your meniscus. You have 2 of them. All right, one's a little O-shaped, one's a little bit of a C-shape. Basically, they're the fibrocartilage pads between the bones of the tibia and the femur, and they provide a little shock absorption. They also help deepen this, I'm going to call it a little socket for lack of better words, because each of these bony condyles of the femur sits down in it, and they roll and glide. But what can happen is we can develop a tear in the meniscus. It's a very common injury, oftentimes as a result of a twisting mechanism with bending or straightening the knee. And that bone kind of catches it, twists it, turns it, and pulls it. There's several different kinds of tears, but being that The meniscus is not very vascular, particularly after about age 25 to 30. Most frequently, surgically, they go in and just kind of snip off the torn part. Prior to that, a healthy individual may have enough blood flow into it still that they can actually do a meniscus repair and resuture it back down, which you kind of see here where they sutured it together, versus here there's a little bit of a longitudinal tear in the meniscus. All right, hypermobility. All right, so you can see she's pretty crazy hypermobile. All right, so at the knee joint, you can have hypermobility or looseness, laxity, double jointedness. All those things are essentially hypermobility. What that means is there's too much movement within the joints. You can have hypermobility of the femur on the tibia. You can also have hypermobility of the kneecap. Both, there are several joints in the knee if we're going to break it down. Hypermobility within any of those structures can cause a problem, and that then may need to be addressed. It may feel like the leg wants to give out, or it's unstable, or when we walk, it just doesn't hold us up very well. Hypermobility can also be caused because of damage to the ligaments. The purpose of the ligaments are to help create stability in the knee joint, and if you have the knee joint like so, and ligaments along the side are overstretched, or the ligaments in the middle are torn or damaged, and that knee gets sloppy and moving all over, that's hypermobile, okay? And it has to be stable in order to be able to walk, climb stairs, squat, do the normal things that we have to do during the day. So hypermobility can be a significant problem. Okay, bursitis. There are several bursa in the knee, and during our demonstration, we'll talk a little bit more about that. But bursa are fluid-filled sacs, and their purpose is to decrease the friction between where the tendon intersects attaches to the muscle. Now, in normal tissue, the bursa is not irritable, not irritated, and if you were to look on a diagnostic ultrasound, you wouldn't see a whole lot. But when we have problems, they then become inflamed and swollen and painful, and that then can create pain and problems. All right, so you can see the prepatellar bursa on the right side is all red and inflamed. It's also larger than a normal prepatellar bursa, and that's a problem. So several things can cause that kind of a problem. For instance, if you crawl on your knees a lot, tissue injury damage can cause bursa. There's several of them in the knee, and we'll maybe talk a little bit more about that. But a bursitis is an inflamed bursa in the knee. Tendonitis. All right, so you can see here in the knee your quad tendons. This is the outside of the knee, this is the inside of the knee. You actually have 4 quad tendons, that's why we call it the quads. And they pull at a slightly different angle. It's 2 kind of in the front, 1 on each side. And if there's an imbalance, that can create problems. Now, tendonitis is inflammation of the tendon. The tendon, again, is the end part of the muscle as it's attaching down to the bone. And different things can cause tendonitis. Overuse can cause tendonitis. Weakness, for instance, and someone then that goes and does a long walk, maybe a hike that they aren't used to doing it, they're going downhill, there's a lot more stress to those tendons, and they then become painful and inflamed. Tendonitis is a little bit different than a tendinosis. Tendinosis is another common problem. Tendinosis actually, if you think of like a bit of a rope, if we were to liken this as a rope on the tendon, a tendinosis is where the tendon begins to fail. Not all of it, but parts of the tendon begin to fail, and we have some points that would normally be an attachment in the muscle where they're kind of breaking off a little bit and tearing. So it's not a really complete tear, a partial tear even, but it's degenerating. The tendon's degenerating. It doesn't have the same quality that the normal tendon would have. So that's tendinosis. It's more severe than tendonitis, both of which can be handled and treated, but tendonitis is a very common problem, and we'll talk a little bit about how to help with that. Okay, dislocations. Probably the most common dislocation that I'm aware of in the knee is the kneecap dislocating. If you have a dislocation, it's obviously going to be painful. People tend to not be able to stand very well. And then that also is going to cause potentially some other damage because there's other structures which help hold that kneecap in place. And if you take it and you forcefully pull it to the side in such a manner due to trauma, it's going to damage some of those other structures which are designed to help create stability and control of that kneecap in the groove while we're moving. All right, so next is a fracture. Another, obviously probably more likely to be from a traumatic event, although sometimes we can have stress fractures. I currently have somebody right now that really essentially had a stress fracture of the tibia. Now, fractures obviously are a problem and need to be addressed medically, but they are definitely a site of problem, would cause a lot of pain, inflammation, limitation walking, and they need to be handled from your medical doctor. All right, so we're going to transition a little bit about things that we can do to help with pain. Now, with all the different kinds of problems and diagnoses, there are some common themes that we can do with multiple different diagnoses. And the first treatment, for lack of better words, is use of ice. Ice is a great anti-inflammatory. Say you fracture something, well, obviously you got to get that handled. But also ice is great to help deal with the inflammation and swelling that's going to be there. The body heals utilizing inflammation. That's the first stage of healing, but we don't want to stay there. We want to progress through the other phases of healing to restore that tissue into back to normal, or as normal as possible. So ice is a great thing to use. It's especially useful for an acute injury. By definition, an acute injury would usually be the first 48 hours of tissue injury. So then in the example of the individual walking down a steep hill, the weekend warrior, they're hiking in the mountains with their kids coming down, and their knees are killing them, and they're all inflamed. Ice is great to use. It helps decrease the inflammation, helps decrease the pain as an anesthetic. It would also decrease the swelling. The problem with swelling is it causes muscle inhibition. In other words, the muscles don't want to contract like they would normally. So they're going to feel weaker. So you want to handle the inflammatory acute injury with ice. Like the dislocation, that would be an appropriate use for the ice. The tendonitis, the bursitis, any of those would be an appropriate use for ice. Okay, so now we have heat. Heat is more frequently used for subacute and chronic injuries. Example would be the guy that came down, still hurting, but it's a week later. Heat would be a good addition. Okay, it stimulates blood flow. You gotta have blood flow for tissue to heal, and you want to get as much blood flow into the area. You want to continue that healing process. So technically, after 48 hours, subacute to chronic injuries, even sprains, strains, any of those things, ice or heat would be an appropriate thing to utilize if you have it. And that's also going to kind of help with that process, speed up the healing as much as is possible by taking care of it. Stretching. Okay, so prevention of injury. Stretching is significantly important. Before exercising, particularly middle-aged individuals that are going to do a lot of stuff on the weekend, but maybe they're not as fit as they used to be when they were 25. And so, you know, you better go stretch so you can prevent injury. Stretching does several things. It increases tissue temperature. It gets the body ready for activity or exercise. It increases the elasticity of the tissue and decreases the risk of injury. So even for going to work, for people that have jobs that are more physical, for instance, someone that maybe works in farming or field work, for instance, or computer work. Well, we'll use that example. It's different in the elbows, but so they're doing a lot of typing stuff. Well, stretching, getting ready for the day, doing something for 8 hours is just as important as if they were just going to go and exercise. So preparing for the day of work or activity, stretching is really important to do. This is a hamstring stretch. It's going to stretch your hamstring muscle. Very simple to do. Sitting in a nice tall chair, back nice and tall, leg out straight, basically just leaning forward. Now you'll notice they're not leaning forward through their back. They're tipping through the hips. Okay, so they want to tip through the pelvis, not bending their back, but tipping through the pelvis to get that pull in the hamstring. Now when we stretch, it's important that we don't bounce. We want to do it nice and gently. We want to sustain the stretch for about a minute. Research shows that a sustained hold is the best way to get that gradual lengthening of those muscle fibers, and that's then going to get you ready for doing your activity. Okay, so strengthening. There's a lot of different injuries that strengthening is important for. The sprains, the strains, the dislocations, the fractures, the patellafemoral syndrome. Almost every injury that we talked about generally will need strengthening after that acute injury. The reason why is because for even acute injuries, when you have that inflammatory process, like we talked about, we get muscle inhibition if you have swelling, all right? And in the knee, you only see swelling if there's 10 milliliters more fluid around that. Well, it only takes 5 milliliters of fluid in the knee to cause muscle inhibition. So you may not even see that your knee is swollen, but yet you're having the muscle inhibition, so strengthening is an important thing to do. For the arthritic conditions, we know that the stronger the joint is, the stronger the muscles around the joint, the less stress to the joint. So the muscles are a bit of a shock absorber, and so they'll help decrease the pain on mild to moderate arthritis very well. So strengthening those quads, strengthening the hamstrings, the calf, all those muscles surrounding the joint, super important. Also helps to create stability of the joint for those hypermobile joints. You gotta have good stability for that function. The sprains and strains of the tendons and the ligaments. Again, we gotta strengthen, especially the ligaments. If you've suffered a significant injury to those ligaments, the muscles have to be able to help control those forces as you're walking and moving around. Otherwise, you may have more laxity and problems and instability in the knee. So strengthening is probably one of the most important things in my mind to do for the long term, definitely. Okay, soft tissue mobilization. Well, what is that? That is, sometimes people call it massage, but there's a lot of different kinds of soft tissue mobilization. But what we're trying to do is get that normal muscle to feel and move like it normally would. All muscles have this kind of suppleness to them. If you feel your thigh muscles or your forearm muscles, there's this amount of pliability to it. And when you have problems, those muscles can become rigid. They can become a little bit ropey, knotted, okay, guarded, tight, any of those kind of descriptive terms. And so soft tissue mobilization helps to get those muscles to be more supple. Other things, we can use soft tissue mobilization to help with swelling, to using more of an effleurage technique to bring that fluid back towards the heart, to help with the swelling and to help with that inflammation, to facilitate that healing process. So soft tissue mobilization is also another important component Okay, joint mobilization. So joint mobilization is going to be appropriate for hypomobile joints, joints that aren't moving well enough. In an arthritic individual, they're going to have hypomobile kneecaps. The joints wear, they get stiff, the joint doesn't move as well. A person that has had a fracture or been immobilized for a period of time also is going to have some stiffness in the joint. And joint mobilization essentially helps to restore that normal movement of the joint. So all joints have some accessory mobility. If you were to take the tibia and femur, like so, and you move it around, there's a little bit of play. There's a little bit of give. All right, same thing with the kneecap. The kneecap has a little bit of give that moves around a little bit. That's normal, up, down, side to side. So there's some mobility that has to happen while we're moving and walking. And if it doesn't, then it changes the mechanics of what's going on, can cause pain and dysfunction and problems. So joint mobilization, here we're pulling the kneecap down as we're bending the knee to help get that joint, the kneecap, to move down. Ultrasound, two different kinds of ultrasound. There is therapeutic ultrasound, we'll talk about that first. And then there's diagnostic ultrasound. Therapeutic ultrasound uses sound waves to help facilitate healing. The body absorbs the sound waves. It penetrates through soft tissues such as muscles, tendons, ligaments, bursa, fat, connective tissues, and it would bounce off bone, things hard surfaces, like the bone primarily. All right, so it helps to increase tissue temperature, it increases the blood flow, so we can use that to help facilitate healing on maybe a sprain or a strain, or a bursitis perhaps even. Now, diagnostic musculoskeletal ultrasound is a little bit different in that that is actually used to help evaluate, in this instance, the knee. All right, and we're going to do a demonstration right now on that. Let me turn this on. Do you have gel? No.
No,
Let me get the gel. All right. So give us just 2 seconds here.
I need the remote control too. Okay.
Oh, over there.
Where? Oh yeah. Ready?
Yeah, there you go. That's fine. True off maybe.
Let's wait till we get hooked up.
So what we're going to do is we're going to look at the knee here. We're going to start by doing a little bit of a look up here at the quad tendon. We talked about tendonitis, so we'll be able to evaluate and look at the knee here. We'll see part of the kneecap.
We're not getting this onto the computer. Is there something you can do here, Josh? Is there something on here you need to push in order to project, in order for that to go?
I don't know. I thought you.
No, you're gonna have to just turn that around and probably. I don't see, unless you know a button that'll.
No.
Okay. Just turn it on. I'll make sure it can be seen. Can't see it.
We need to turn off the mirroring. Here we go.
adjust this so you can see it.
Here. I think it's a little bit behind.
Yeah.
No, that's too much. You can see her foot there.
Here we go.
Alright, okay. Alright.
Perfect.
Alright, so we're going to look at her quad tendon here. Not used to looking at it upside down.
Want to come in front?
Alright. And we'll freeze that there. Alright, so here we have the quad tendon here. Now you can see right here, this is the kneecap, this shiny little or bright white area, that is the kneecap, okay? And then you can see the quad tendon, these fibers down here that are nice and stringy looking, that is the quad tendon. Alright, now with pathology, that changes, okay? That part, if there's an issue down on the tendon, you will see changes on these fibers as they're going down. It doesn't have that same bright, shiny, kind of whitish look. It looks dark, okay? So we can look at that. We can look at the tendon. Also, we would also see the bursa there. Okay, now we'll go down a little bit lower. We're going to look at the patellar tendon. Okay, on the left of the screen, you see the kneecap again, right here. And alright, so right here we can see this patellar tendon very nicely. Right through here, this kind of straight stringal area. Okay. Now there's also bursa. There's a deep and we'll go a little deeper here. There we go. Alright. There we go. So we can actually see both bones on our patient here. So you can see the tendons coming and attaching over here, and down below we would have the bursa, and it all looks very good. When you have a bursitis, it looks like this big sac that's all black, okay? And you can also look for the bursa on top of the kneecap as well as farther deep down, but she's got a nice healthy knee, obviously. So that's another use of the tool for diagnostic musculoskeletal ultrasound. Now we can also look at the tendons or ligaments. All right. So all right. So right now we're looking at the joint. Then we can follow that, the ligaments hanging on top of that. We can follow that ligament down and watch it trace and track down into the bone. Okay, so the ligament right here, attaching right down nicely into the bone. Okay, so we can use like diagnostic musculoskeletal ultrasound to look at the bursa, the tendons, the ligaments, the bone to a degree, the joint surfaces, as well as the ligaments and all that connective tissue. One more thing we'll do real quick, just bend your knee. Okay, we'll do kind of a look down onto the joints. It's called sunrise view. Alright, so now we kind of have a sunrise view of the joint there, and which that kind of evaluates the joint surface. Okay, so you can see the bottom line is the bone, the femur, okay, and then this darker area on a normal healthy knee should be visible, and that's the cartilage, alright? So on someone that's having some arthritic changes, that would be much more narrower, and there may be also other things. You might see some extra bone spurs and things on the sides too. Alright, so that's diagnostic musculoskeletal ultrasound, another great use of ultrasound technology, but different than therapeutic ultrasound. Tell. Alright, so another treatment technique, for lack of better words, is taping. There's a lot of different taping on the market. They can be used. There's athletic tape. There's the brown tape. There's KT tape, kinesio taping. Very common. We see a lot of professional athletes wearing that. But taping does several different things. It can be utilized in the instance of kinesio taping. It is utilized potentially for swelling. There's little micro cuts in the tape, and you can put it on in a specific fashion because it already comes pre-stretched on the little roll to help basically take a little bit of the load off to help the vast microvasculature move that swelling out. You can also use it to help to facilitate muscle contraction. If you have a weak muscle and it's having a hard time to contract because of inhibition or other issues, you can use tape to help facilitate that. To a degree, you can use it to help with a kneecap that's poorly positioned or hypermobile, to help create better stability in there, or help with the tracking. So taping is another technique that can be utilized for treatment techniques. All right. So we're going to talk about a few different tips now. So tip number one, if you do have pain in your knee, if you have swelling, if you have redness or heat, a great thing to do would be to ice. Get that ice on there for 15 or 20 minutes a day. Make sure that there's a layer between you, your skin, and the ice so that you don't injure your skin at all. But get some ice on there to help with that inflammation. 15 to 20 minutes a day, 3 to 4 times a week. 3 to 4 times a day would be great. 3 to 4 times a week is not going to be enough. You need to do it 3 to 4 times a day. But ice is a great thing. It's also normal, I know family members that kind of complain about putting ice on. Okay, well it hurts. Okay, so when you put ice on, at first it's very cold. All right, after a little bit, that cold becomes more of a kind of a burning, and then it becomes more numbish. Once you get to that numbish stage, it's done its job, it's nice and pink, and then you take it off. Okay, but it does not feel comfortable to ice. People don't really like ice, but it helps. So people are willing to do it. So I really encourage you to stick through if it's uncomfortable. Make sure you have a layer of to protect your skin, but get that ice on there. It'll be very helpful. Oh, looks like we got a duplicate. Alright, stretching. Begin stretching. Okay, most of us stop stretching in high school when we're done with PE, to be perfectly honest. Really, most of us do. So we can all use some stretching. These are two of the foundational muscles around the knee. They both attach up at the hip. However, stretching your quads, that's a great way to do it. Get a chair in front of you. You'll notice that their knees pretty straight, their legs pretty straight with the other leg. You don't want it out in front. Okay, if you're trying to stretch your quad and you're doing it like this, you're not going to get a very good stretch because one of the muscles that attaches up above the hip. You got to make sure that that thigh bone is parallel with your other leg. And then by pulling up on it and keeping your back tucked so that you don't end up arching your back and injuring yourself, give it a little pull. Hold that stretch. Hold it for a minute. Do it 3 times a day. Other thing with the quad, the leg's going to want to kind of go out to the side. You got to keep it tucked under because of the IT band here. It's going to want to pull out to the side. So keep it tucked under so you feel a strong, moderate stretch in the front of the knee. You should never stretch into pain. If it hurts, it's too much stretch. You need to back off. Make it moderate, mild to moderate, but tolerable because you want to hold it for a whole minute. A minute's a long time when you're holding it. So get that whole minute stretch. Sustain it, and you need to do it throughout the day, at least 3 times a day for a minute. Ideally, even a little bit more. But muscles have to get stretched. Hamstring stretch, same principles. Mild to moderate, not painful, sustained multiple times during the day. And in this situation, you want to make sure you're using that good technique, not bending over in the back. Keeping that back nice and straight, so that the motion's coming from the hip. That hamstring's attaching on that part, that bony part that you sit on, and down below the knee. That's where it attaches. So you have to make sure the knee's straight and that we're tipping that pelvis backwards as you lean forward to get a good stretch. Try those stretches. Strengthening. Couple of easy exercises, okay? One of the most weak muscles that we see are the glutes. Quads are probably another one. So simple exercise, bridges. Now as you see, as you do a bridge, you want to make sure you keep your spine nice and straight, and you don't want to be bending through all the different spine segments. That can cause problems, particularly if you have a history of back pain. But this is great because it affects your butt muscles, the glutes. Well, the glutes affect the knee. We talked about, I see frequently people with weak glute muscles with knee pain, and they're walking and they're kind of walking all cattywampus, and that knee, when they squat down, it turns in, and they don't have enough strength here. I've seen it in runners, I've seen it in soccer players, a lot of athletes. They don't have the demand and the torque here from those muscles to be able to control what happens at the knee, and so then they get the patellafemoral issues and the pain. So we have to address the hip as much as you do the knee. So do some bridges. Start with 10. Do your 10. Wait a minute. Do another 10. Wait another minute. Do a third set of 10. Start with 3 sets of 10 once a day. If that's too easy, cool. Do 15. Do 20. You can even progress to more advanced. Sometimes I'll have people do a single leg bridge. That's hard work. Doing 3 sets of 20 single leg bridge, you better be in good shape because that's going to work a lot. Straight leg raises, the one on the bottom. Very simple to do. Again, I would suggest that you do bend the other knee, especially if you have a history of back pain, to help control your back and spine, keeping it in a good, comfortable position. But then you're also going to be working the front of the hip muscles too. Quads in front of the hip. Great, simple exercise to do. Start with 3 sets of 10. Make sure you can do that. You may be sore, but that's different than pain. If it's sharp, if it's really too much, okay, back off. We don't want pain. But muscle soreness, aching, that's normal. That's lactic acid in the muscle after exercise. That'll go away. Drink lots of water, keep doing it, keep the blood flowing in the muscles. Goes away after a little bit of time, give it a couple weeks, but do try it. 3 sets of 10, start with that, see how that goes. If it's easy, you can adjust it a little bit. But get going on that and make sure you start strengthening those quad muscles. Heat, okay, subacute injury. Go ahead, get the heat. Arthritic knee joint. I'm 80 years old, my knees hurt, they're shot. I don't want a knee replacement. Okay, heat is a great thing. It can help with the pain. It's soothing. It's a subacute injury, chronic injury. Okay, the bursitis. Or maybe not bursitis, but the tendonitis, or my quad muscles strain. It's now 2-3 weeks out, it's still a little buggy, we're getting the heat on there. Help facilitate that healing process by increasing the blood flow. The heat soothing, people are much more willing to put heat on before ice. Now on a day like this when it's 104 degrees, maybe not, but generally speaking, the heat's going to be much more comfortable and more tolerable for people than the ice. They don't, at least my family doesn't whine as much about putting heat on as the ice, okay? So heat, very important thing to use. Joint protection strategies, we didn't talk a lot about that, but arthritic knees, there are also, when we have limited stability because of ligaments, maybe it's not appropriate for surgery to stabilize it for whatever reason. We may need to do a joint protection strategy. They also have braces. There's a lot of different kinds of braces. There's the neoprene braces. There's the ones with the holes cut in it. They have the stays on the side. You have a little bit more aggressive one. They even have braces to help unload a joint for a person that has maybe some arthritis on one compartment of the knee, but not on the other side. Then they can create a brace that takes a little bit of that pressure off that one compartment to make them to allow them to walk more comfortably, better, with less pain, and be able to do their activities. But joint protection strategies are an important thing to consider too, for arthritic joints, for unstable joints, for chronic painful joints potentially, for rheumatoid arthritic patients, joint protection strategies. And really, if we think about it, we want to protect all our joints through our entire life. When we're younger, we don't think so much about it. We just kind of do our thing, and maybe playing basketball or diving on the ground and just, killing our knees there. But really, if you take care of your knees when you're younger and you do what you can, you stay strong, you maintain a good body weight, that's something else that I want to talk about briefly. There's this 4-to-1 ratio for joints. So when we're talking about weight bearing, if we have, say, 10 pounds extra that we're carrying, that's 40-pound more load on our joints. On the other hand, if we lose those 10 pounds, we've now decreased 40 pounds of our stress to our joints. And it multiplies when we go up and down stairs. It's something like 8 to 10 times the amount of body weight. So treating those joints respectfully by maintaining a good body weight is really, really important. And if you have a question on that, I have lots of resources that can help you with nutrition and body weight. And we can talk about that if you want at some point. Just write a little comment. But joint protection. Protect your joints when you're younger. They're going to be better able to serve you when you're older, when you want to do other things. Okay? All right. Now, there may be some of you out there that are having knee pain right now. I get it. If you're having one and you would like to talk to me or Stacy or someone else on our staff about that, go ahead and send us a comment. We'd be happy to talk with you. It's a free consultation. We'll talk with you. We'll look at what's going on. We'll see if there's something that can be done to help you, and we'll point you in the right direction if there's something that we can help you with. Now we can do that both here in the office, but we also utilize telehealth services, so we can connect you from a distance too if you're not in the immediate area. So we want to be able to be helpful for you in that capacity. So feel free to contact us and let us know. You can call us 592-7117 or contact us on our website, vancept.com, free consultation. Also, you can send a link on or a comment on Facebook. Now, we're also going to have another seminar. This seminar is Thursday, July 30th at 6 o'clock. It will be on ankle pain. Lots of different causes of ankle pain. So similarly, we're going to talk about causes of ankle pain, things that you can do to handle it. We want to be helpful for you. If you have questions about ankle pain, let us know. Also, we'd love for your feedback too. If you have a specific question about something else, or you want information on something else and you think maybe other people would be interested,
You can ask right now.
oh, ask right now. Someone else is telling me to ask right now. But if you have some suggestions for other webinars that would be helpful for you, let us know. We want to be service to you to help you fulfill your needs and find out what they are. So if there's something in particular, a topic that would be helpful for information, please let us know that. We'd be happy to create a seminar if there's enough interest to handle that. And you know, if you have a specific thing and there's not enough interest, that's okay. We can still handle that and talk to you about it. So, you know, let us know. Let us know. Okay, so we'd love for you to give us some feedback. Do we have something to go out?
No, I've got a question.
Okay.
John Moore says, thanks for the information.
Oh, you're welcome. Glad to help. Yeah, if you do have questions, we'll start handling them right now.
Tammy would like to know, will the tape help my shoulder with the swelling?
You know, the kinesio tape can be utilized on a variety of things. The trick is putting it on correctly, because the tape comes with a little bit of a stretch on the paper that it's on. And so there's a specific technique in applying it to help with the swelling. It's possible that it can, potentially, yeah. Ice is going to be an easy one though, definitely ice it. But the kinesio tape there's certain patterns and things that you have to put on with the kinesio tape too. It's a little more complicated. Any other questions? All right. Well, thank you for joining. Hope you have a good night. And again, if you do have any questions, feel free to send them our way. We'll handle them. You can also visit us on Twitter at Vance PT Exeter. If you are on Facebook, like us, Vance PT, Vance Physical Therapy. And have a good night, and hopefully you'll join us for the next seminar.